Okay, so if you've had that moment where your nose is completely blocked, you can't sleep, your mouth breathing all night, or your chest feels tight, and you're thinking, why can't I breathe? Well, if you live in Houston, it is extremely common because of mold, pollen, and humidity, and it makes allergies almost year round here. And today I'm going to walk you through exactly what you could do step by step when allergies make it hard to breathe. My name is Dr. Lola Shaye. I'm a board certified family and lifestyle medicine doctor and founder of InTouch Primary Care in Sugar Land, Texas. And what we do is provide membership based primary care for people who value thoughtful, unrushed visits and preventative focused strategies. I work mainly with adults, especially women in midlife, who want clarity, they want a clear plan instead of confusion. And our patients come to us when they're ready to stop reacting to symptoms and they want to start building real sustainable health. So, we're going to be talking about allergies today, but let's first separate two different problems that happen with allergies. So, nasal congestion, which is allergic rhinitis, and chest tightness or wheezing, which can be allergic asthma. They feel similar, but they're not the same. So, if your nose is blocked, that's usually inflammation in your nasal passages, and it can be triggered by allergens like pollen, like mold, dust, or pet dander. If your chest feels tight, maybe you're wheezing or it's hard to take a deep breath, that could be airway involvement. And up to 40% of people with allergic rhinitis also have some asthma component. So, what can you do when you can breathe through your nose? Well, again, always check with your own doctor. This is general advice, but many people will get relief with a nasal steroid spray when they use it daily. And this is gold standard treatment for allergic rhinitis. Studies show consistently that when you use an intranasal corticosteroid, it's more effective than using an oral antihistamine for congestion. And that's because it directly reduces the inflammation in the nasal lining. So some examples are fluticasone, which is like Flonase, triamcinolone, mometasone, and all of them are pretty much over the counter at this point. So the key, though, is it works best when you use it consistently, not just when you use it as needed. So that's very important that it needs to be used consistently. What I found in my experience, a lot of patients will not notice much of a difference the first 1 to 2 days, and then it tends to kick in like day three. So consistent daily use is important. Okay. The second tip, if you feel like you can't breathe due to nasal congestion, is add a saline rinse. And daily saline irrigation can improve symptoms by as much as 30 to 50% in studies. It physically washes away allergens out of your nasal passages. It reduces swelling. So you can use distilled or previously boiled water. You shouldn't use tap water for this. So this is can be very, very helpful, very, very useful. Simple, but a lot of people delay doing this, and it can really make a big difference in terms of improving symptoms. Okay, before we go to the last tip, if this is helping, please take a few seconds. If you've not already subscribed, go ahead and subscribe, like, share, comment, do something because it does help our algorithm. It helps get the word out so more people can be helped and it can really make a difference for someone else. So I truly appreciate you taking time to do that. Okay, step three. Another thing you can do, and this is after you check with your own doctor, is you can add a non-drowsy antihistamine if needed. So these can help with the other symptoms like sneezing and itching, but they're not as good for congestion like nasal steroids are. So those can be helpful for additional symptoms that some people will have with allergies. Okay, we can also, let's talk about eye symptoms. So there are eye drops over the counter now that can be helpful also for eye symptoms. And a little trick is you can keep them and put them in the fridge so that they feel cool when you drop them into your eyes. You can put cool compresses on your eyes as well that can help to relieve eye symptoms quite a bit. So now let's talk about chest tightness. So if you're wheezing, you're coughing, you're struggling to speak in full sentences, that's not just allergies now. That needs medical evaluation. So if you've ever had an inhaler prescribed, you want to use it as directed. If the breathing worsens, you definitely need to seek urgent care, emergent care. But here's the bigger picture. If you keep having allergies every season, every year, it may be time to stop reacting. Houston allergens are not going away. If you're needing to take more and more medication, but you're still struggling, that may suggest that you have an underlying immune response that needs to be retrained. And that's where we start talking about long-term solutions like immunotherapy. But that's a whole different conversation. You can watch my last video about that if you want more information about that. And in the next video, I'm going to be talking about something many people ask me, which is, do supplements actually help allergies, or is it just marketing? So if this has been helpful, remember, subscribe. And if you're in the Houston area and you're tired of rushed appointments, you're tired of prescription-only care, come join us at InTouch Primary Care. We take care of busy adults who want proactive, personalized medicine, not just symptom management. We focus on identifying root causes, building long-term strategies, helping you feel well consistently, not just when something goes wrong. And health insurance is not required. We're membership practice. So if you feel like allergies are controlling your sleep, your energy, your quality of life, we offer personalized allergy evaluations and long-term treatment options right here in Sugarland. So breathing clearly shouldn't feel like a luxury, and you can change that today.